Body health equipment is the best for a microdermabrasion treatment. The reason is simple. The machines are unique since they have disposable diamond ends called diamond sticks.
Microdermabrasion consists in a non-invasive, painless mechanical peeling that eliminates the exterior layers of cells in the skin, spots, furrows, and acne scars. Microdermabrasion is applied by using diamond sticks, exclusively created by Body Health, which are hypoallergenic disposable heads made of tungsten carbide. As the material is disposable, the abrasion properties are preserved in each application, offering a greater abrasion power. The intensity of the abrasion is determined by the grading of the head used, the intensity of the vacuum, and the pressure the operator exerts on the head. Diamond sticks come in 3 sizes and different gradings: 400, 600, and 1000 microns. They will be selected according to the disorder and the area to be treated.
Let's see how an effective treatment is carried out.
The patient is in a dorsal decubitus position. Her head must be placed on a pillow with a disposable case. The stretcher is covered with a disposable case. The patient must wear a protection hairband and, if necessary, she can cover her body with a blanket. The therapist sits on a high stool at the patient's head or can be stand up. The therapist must use a piece of gauze to cleanse the patient's skin with cleansing gel and then with a deeper degreaser like acetone at 100%. The areas to be cleansed are face, neck, and neckline.
Remember to follow the instructions in the manual that corresponds to the equipment that is being used, so as to program the machine correctly.
The power of the facial treatment ranges from 30 to 70%, depending on the patient's skin and the abrasion depth you want to achieve. The diamond sticks are disposable, self-adhesive heads made of tungsten carbide. They come in the following microns. Number 1000, to treat eyelids, the nose, and peribuccal area and sensitive skins. Number 600, to treat the face, neck, and neckline and mixed skins. Number 400, to treat thick and oily skins and spots and marks as well. The operator must wear latex gloves and can use a Tusculum or a magnifier throughout the treatment. Good light is a must. It is advisable to start from the forehead so as to test the disposable head ideal for that type of skin. Then, a disposable 20mm head of 600 microns is selected. The self-adhesive diamond ends must be removed and then stuck on the chrome-plated head. Discard them after use. It is important to test it on an area of the forehead that is not very visible, like the scalp implant. The microns of the testing disposable head will be selected taking into account the patient's skin. Thick skins, a 400 micron head will be used. Thin skins, 1000 microns. Mixed skins, 600 microns. Once the disposable diamond stick is selected, it is placed in the 20mm head in order to start the treatment. Let's see it step by step. The operator must rotate the patient's head as she will work on the exposed hemiface. She will work from the forehead to the neckline, sliding the head smoothly and applying circular movements. However, the oval center of the face will be treated later with a 10mm head. As the heads used are disposable, their abrasion property is preserved as there is no erosion of material like in other treatments. For this reason, the cutters do not need to be sterilized. It is very important to straighten the area to be polished with the other hand. Then, the patient's head is rotated to treat the other hemiface. Then, the therapist must change the 10mm head and stick the self-adhesive diamond end. The space between the eyebrows and the nose must be treated with sliding and circular movements. The therapist will determine the number of times she will repeat the sequence by observing the level of abrasion that is being generated. Do not apply on areas of the skin which show signs of inflammation, infection, or rash. Then, remove the self-adhesive stick used and stick the 1000 micron diamond stick. Now, the patient must place her head in middle position so as to work on the oval center. The therapist must apply sliding and circular movements to treat the following areas: lower and upper eyelids, nose area, peribuccal area, corners of the lips. If the patient has spots, marks, or acne scars, the operator must change the self-adhesive stick for a 400 micron stick. She must apply sliding and circular movements on the spots, marks, and/or acne scars. She must apply sliding and circular movements on the spots, marks, or acne scars. To finish the treatment, the therapist must change the chrome-plated head for a 20 mm head and stick the 1000 micron diamond stick. The operator must rotate the patient's head as she will work on the exposed hemiface. The therapist must apply even slidings and circular movements from the forehead to the neckline, except for the oval center. Then, the therapist works on the other hemiface. When microdermabrasion is over, the stick is removed and discarded. The patient's face must be cleansed with a cotton swab soaked in moisturizing lotion and a chamomile decongestion stabilizer. We recommend to apply the post-microdermabrasion decongestant face pack abundantly on the areas treated. Leave it from 10 to 20 minutes, depending on the type of skin.
Now we will give you some tips to finish the treatment.
Remove the disposable cutters from the heads. Clean the chrome-plated surface of the head with ethyl alcohol at 75%. Remove and discard the latex gloves. Regarding the patient that has just received treatment, follow these instructions. Remove the rest of the decongestive face pack with sponges soaked in water. Dry with wipes.
In this way, the microdermabrasion treatment comes to an end. I am sure that if you follow the instructions step by step, you will be able to give your patients the solutions they're looking for, and the treatment will be a complete success.